Today, let's discuss popliteal bursitis, a condition that occurs when the popliteal bursa, a fluid-filled sac behind the knee, becomes inflamed. This condition is sometimes referred to as a Baker's cyst. The bursa's role is to reduce friction between tissues during movement, but it can become swollen or irritated due to injury, overuse, or underlying conditions like arthritis, resulting in pain and swelling behind the knee. Popliteal bursitis is most common in middle-aged and older adults, especially those with arthritis, but it can also affect athletes who participate in activities that place repetitive stress on the knee. The primary symptom of popliteal bursitis is swelling at the back of the knee, often accompanied by a feeling of tightness or fullness. Some people experience pain, particularly when extending or bending the knee. In severe cases, a visible bulge may appear, resembling a small, soft balloon at the back of the knee. Patients may also report stiffness and a limited range of motion. Interestingly, many cases of popliteal bursitis are asymptomatic and only discovered incidentally during imaging for other conditions. A typical case study might involve Michael, a 45-year-old avid runner who recently increased his training intensity. He noticed swelling and a full sensation behind his right knee, which became increasingly painful, especially after long runs. Michael initially attributed the discomfort to muscle fatigue, but as the pain persisted, he sought medical advice. His physician performed a physical exam and ordered an ultrasound which revealed an inflamed popliteal bursa consistent with bursitis. Michael's case highlights the connection between overuse, repetitive motion, and popliteal bursitis, a common scenario for many runners and athletes. Diagnosis of popliteal bursitis typically begins with a physical exam to check for swelling and tenderness. Imaging techniques such as ultrasound or MRI are often used to confirm the diagnosis, as they can visualize the fluid-filled bursa and differentiate it from other knee conditions like meniscal tears or deep vein thrombosis, which can present with similar symptoms. Ultrasound is especially helpful for assessing the size of the bursa and identifying any underlying pathology. A 2021 study emphasized that ultrasound-guided imaging offers high accuracy in distinguishing popliteal bursitis from other knee conditions, helping to avoid misdiagnosis. Treatment for popliteal bursitis usually begins with conservative management. Resting the knee and avoiding activities that aggravate symptoms are essential first steps. Applying ice and using compression bandages can help reduce inflammation and relieve discomfort. Non-steroidal anti-inflammatory drugs, or NSAIDs, are also commonly used to alleviate pain and swelling. Physical therapy exercises, such as gentle stretching and strengthening of the quadriceps and hamstring muscles, can help improve knee stability and relieve stress on the bursa. A 2022 review published in Sports Medicine found that regular quadriceps strengthening and hamstring stretching exercises were effective in managing symptoms and reducing recurrence rates of popliteal bursitis. If conservative treatments don't provide sufficient relief, more invasive options are considered. Aspiration, or draining the fluid from the bursa, can reduce swelling and improve symptoms. This procedure is usually performed under ultrasound guidance to ensure accuracy. However, fluid may reaccumulate over time, and repeated aspirations may be necessary. Some people benefit from corticosteroid injections, which can reduce inflammation within the bursa. A study from 2020 demonstrated that corticosteroid injections provided significant pain relief for most patients with persistent popliteal bursitis, though recurrence was more common among those with underlying arthritis. In rare cases, surgery may be recommended, especially if there is a structural issue within the knee joint contributing to recurrent bursitis, or if the cyst becomes very large and causes severe symptoms. Surgical options may include bursectomy, which is the removal of the bursa, or repairing any structural knee abnormalities that may be contributing to bursa irritation. Research indicates that surgery is generally reserved for cases where other treatments have failed, as it carries higher risks but can provide long-term relief in cases of chronic or complicated bursitis. Emerging research suggests that lifestyle modifications and strengthening exercises may help prevent the recurrence of popliteal bursitis. Maintaining a balanced exercise regimen that includes stretching and strengthening the muscles around the knee can reduce strain on the joint and prevent bursitis from developing or recurring. A 2023 study highlighted the benefits of a prehabilitation approach in athletes, which involved targeted exercises to prevent knee injuries, including bursitis, by improving overall knee stability and muscle support. In summary, popliteal bursitis, or Baker's cyst, is a condition characterized by swelling and pain behind the knee due to inflammation of the popliteal bursa. While it can often be managed conservatively with rest, ice, and physical therapy, more severe cases may require aspiration, corticosteroid injections, or even surgery. For anyone experiencing persistent knee pain or swelling, consulting a healthcare provider early can help guide effective treatment and prevent worsening symptoms. Thank you for watching, and don't forget to like, subscribe, and tune in next time for more information on managing musculoskeletal health.